So let's have a look at foot care. And we've got a fairly normal pair of feet here, but we need to look at some various aspects of where we're going with foot care. So let's have a look first of all at this nerve damage that we've mentioned. Nerve damage in feet, it is very common, and a lot of diabetic people will end up with some degree of nerve damage somewhere along the line, but it certainly can be minimised with good care. So what's the problem with nerve damage to feet? Well, it can do two things. First of all, it can end up with you building up hard skin on areas of feet that carry your weight. So they tend to be on the heels of the feet or on the balls of the feet. Those areas carry our weight. And what can happen when you've got this nerve damage or this neuropathy is that we build up heavy layers of callus or hard skin on those weight-bearing areas. And so this abnormal build-up of hard skin, this abnormal build-up of callus is a serious problem. And you can manage a small amount of that yourself, and we'll talk about that later on. But if the callus build-up is really heavy, and it can be for some people, you'll need to get proper professional chiropody to sort that out. Now, the other thing that nerve damage can cause is a change in sensation. Nerves mean feeling, means sensation. Now, we all know how our feet feel, but this sensation to your feet, this normal feeling of your feet, can get changed if you get neuropathy, this nerve damage. And so it can change to a whole range of feelings, such as pins and needles, or a simple tingling. It can just be numb. This numbness when you see, well, I know my feet are there because I can see them, but I actually can't feel them. And the final change of sensation is pain. Now, bizarrely, some people can get the whole range of those symptoms, and it seems very odd to say that you could have numb feet that are exquisitely painful. But it's very true, and if you've got it, you know exactly what I'm talking about. So let's have a look, first of all, at this build-up of callus. You can see from the slide that exactly where it is for a start off. It's right on those weight-bearing areas. So where the toes get sort of joined into the foot, if you like, those areas carry the weight when you walk, and every time the foot goes to the floor, the nerve endings which have been damaged, just make sure that you walk on the same places all the time. And to protect the foot from damage, the foot lays down more and more layers of hard skin or callus until you end up with almost this deep layer of callus that's almost translucent. Now, if you look very carefully at that big build-up of callus, you can see some tiny pinpricks of what are old blood. Now, next slide here shows that in a little bit more detail. It's showing an area of build-up of callus, build-up of hard skin, with quite marked areas of old blood underneath. Now, what's happening there is that this deep layer of callus is like concrete. And when you walk, it moves and shifts and tears the good skin underneath and makes it bleed. And that's what we've got here. We've got bleeding under the callus. Now, if you don't remove that hard skin, that callus, that bleeding just gathers pace and becomes more pronounced until ultimately it blows a hole in your foot, actually. Now, this slide is where the podiatrist or the chiropodist has really taken down the layers of hard skin, and you can see almost the blade marks where he or she has actually taken off the hard skin, and that foot is now out of danger. So let's have a look next at poor circulation. We've already said that blood supply it can be definitely impaired to your feet. We call it ischemia, this poor blood supply, although I wouldn't try to remember that word. But the diabetes can affect the large and the small blood vessels and clog them up. And so the foot becomes quite cold to the touch. There are no pulses. We're very commonly aware that we've got pulses in our wrist, but not many people are aware that we've got pulses in our feet. And your GP or your practice nurse who does your checkup should be able to feel these pulses and certainly point them out to you and tell you whether they're present or not. The foot, if it's got poor blood supply, the skin becomes friable and red and shiny and thin. And like nerve supply, if the blood supply is poor, again it will cause pain, but particularly at night when you're lying flat and your blood pressure drops. Okay, now the next risk with foot care is infection. And you might think, well, you know, my feet aren't infected. Well, no, they're not, and we hope that they won't be. But if you get a break in the skin, for whatever reason, however simple, however minor, any break in the skin, germs can get in, and then you will see these signs of infection. So, colour, red, inflamed. Pain, well, it can be acute. But don't be deceived here, because if you've got neuropathy as well, the nerve endings are damaged, you may not feel pain at all. So don't particularly use pain as a good judge. Use colour, use swelling and temperature. The foot will swell, the toe will swell if it's infected. And the temperature. Anything that's inflamed and infected becomes hot to the touch. And comparing that toe with another toe, you may well feel a big difference in temperature. Now, if you get any of these signs of infection on a foot or a toe, not particularly a leg, but certainly a foot or a toe, then it's crucial to see the GP as soon as possible. And if it's the weekend, it's probably very worth your time seeing the GP even at the weekend. Antibiotics are difficult to get these days for lots of very, very good reasons. But if you've got diabetes and you've got an infected toe or foot, the GP will want to prescribe antibiotics, and probably fairly hefty doses, and that needs to be done as soon as possible, because infection on a diabetic foot can spread rapidly through the foot and up into the leg.